There is a critical blood shortage here in the Valley, and as we continue battling the coronavirus pandemic, blood donations are needed now more than ever. We paid a visit to the Central California Blood Center. Urcelia Lacaze is the director of marketing and shared with us why it's crucial we donate blood. It's simple, safe, and can save many lives.
So unfortunately, because of the pandemic, we have seen a severe drop-off in donors coming in to donate. And one of the main reasons for that is obviously folks are afraid to come out and donate, but also because we've had a ton of our blood drives, our community events, if you will, canceled because they would be considered gatherings. And so naturally, when COVID first hit, immediately within 48 hours, we lost hundreds of blood drives, which represents thousands of blood units collected. And so it has definitely had a huge impact on our ability to collect. We are distancing our donor chairs, only letting folks in who are here to donate, so there's no additional bodies coming in. Temperature checks, masks, all of those things that you would expect are very much in place at all of our donor centers. And so we encourage folks to not be afraid. Donating blood is essential, it's critical, and we ask them that they would still come in. Truly, it's unprecedented. In fact, I've had my predecessor, who was our director of marketing before, reach out to me and say, I can't imagine being a blood banker in the middle of a pandemic. And so, as I said, it's always difficult. You know, donating blood is not something that we think about regularly. It's sort of one of those out of sight, out of mind. So our job is to constantly be out there asking people to come in. And I've had family and friends tell me, man, you're always asking for blood, you're always begging. And that's right, because we always need it. It only has a 42-day shelf life. So if I don't constantly ask you to come donate, I don't have enough for our local hospitals who are doing the great work of taking care of all these patients. The need for blood has always been a need for every community. And so traumas, premature births, the hospitals are always in need of those blood products. They are extremely life-saving and extremely important. And so regardless of the pandemic, the need for blood continues. And that's why we do what we do. In order for our community to be ready and equipped for the hospitals to provide services to their patients, there has to be a certain amount of blood available. And the only way we have that blood is if blood donors come in consistently to donate. Most people can donate, yet less than 10% of those who are eligible actually do. And all they have to do is have a really good meal in the morning, drink lots of water, and come in with a form of ID. That's it. Anybody who's 16 or over can donate blood. If you are under 18, then we ask that you bring in a parental consent form. We have them here or on our website. It's probably 45 minutes to an hour at the most. So really we're asking you for about an hour of your day. The longest part is the screening questions. So it's the easiest part, it's just us asking you some questions, but you're in the chair less than 15 minutes. We can promise you the needle is not painful. That's usually a big fear that folks have, but our staff, they're professionals, this is what they do. And so that's it. 1 pint of blood can save as many as 3-4 patients because more than one blood product is made from 1 pint of blood. So you can, with your 15 minutes in a chair, can save as many as 4 or 5 patients in a hospital right now.